the silent warning signs of a stroke that most people miss until it's too late. If you are over 60, what I am about to share with you could be the most important health information you ever receive. Because stroke is the second leading cause of death worldwide and the third leading cause of long-term disability. And the research shows that up to 90% of strokes are caused by risk factors you can modify. Yet fewer than half of all older adults can correctly identify the warning signs of a stroke in time to act. Welcome to Thrive After 60, where every week we bring you science-backed strategies for living stronger, sharper, and healthier in your 60s, 70s, and beyond. Please subscribe if you have not already. And before we begin, this video is for educational purposes only and is not a substitute for personalized medical advice. Always speak with your doctor about your individual situation. If you believe you or someone near you is having a stroke right now, stop watching this video and call 911 immediately. In April 2026, Johns Hopkins Medicine issued a specific public briefing on stroke prevention and awareness. Their message was urgent and precise. At least 80% of strokes in the United States are ischemic, meaning they are caused by a blocked artery cutting off blood flow to the brain. And if treatment is provided within 4.5 hours of first symptoms, medication can be given to break up those blood clots and dramatically reduce the damage. The first 4.5 hours are critical and can make the difference between full recovery and permanent disability. Quickly recognizing the signs and symptoms of a stroke early is therefore crucial, and this video will help teach you exactly what to look for. And more importantly, you are going to memorize a simple acronym that could save your life or the life of someone you love. Johns Hopkins and stroke researchers across America use an acronym called Be Fast. This is the single most important thing in this entire video. Commit it to memory before this video ends. Share it with your family today. B stands for balance, specifically sudden loss of balance or coordination. If you or someone near you suddenly seems to be stumbling, staggering, or unable to walk normally without any obvious explanation, this is a warning sign. The key word is sudden. We are not talking about feeling a little dizzy after standing up too quickly. We are talking about a sudden, rapid, and unexplained loss of balance. E stands for eyes. Sudden vision changes, blurred vision, double vision, or loss of vision in one or both eyes, happening suddenly and without explanation. Not gradual vision decline that has been building over months. If you or someone near you suddenly cannot see clearly out of one eye, or sees double when they did not a moment before, this is a warning sign. F is for face drooping. Ask the person to smile and look carefully. Is one side of their face drooping, uneven, or not working the way it should? An uneven smile or a drooping face is one of the most recognizable and most classic signs that something is happening in the brain. If you see this, act immediately. A stands for arm weakness. Ask the person to raise both arms and hold them out in front of them. Does one arm drift downward or seem unable to be raised at all? One-sided weakness or numbness in an arm, a leg, or the entire side of the body is a hallmark stroke symptom. If the person cannot raise one arm when they could a moment before, this is a warning sign. S is for speech. Is their speech slurred or strange? Can they repeat a simple sentence clearly? If speech is slurred, confused, or the person cannot speak at all, this is a warning sign. Speech changes can be subtle, not just obvious slurring, but also sudden confusion, using the wrong words, or being unable to understand what is being said to them. T stands for time to call 911. Immediately. Not in a few minutes. Not after you have called the doctor's office. Call 911 now. Do not drive the person to the hospital yourself. Paramedics can begin assessment and treatment on the way, and stroke centers expect the ambulance. Every minute you wait is 1.9 million more neurons lost. Johns Hopkins specifically adds that other symptoms can also occur: severe sudden headaches without a known cause, fainting, or losing consciousness, and that these are more common in women. If these happen suddenly and without explanation, treat them with the same urgency as the be-fast symptoms. There is also a warning sign that is most commonly dismissed, and that represents one of the most critical opportunities to prevent a full stroke that most older adults completely miss. A transient ischemic attack, known as a TIA or a mini-stroke, is a temporary blockage of blood flow to the brain that causes exactly the same symptoms as a stroke, but resolves on its own within minutes to hours. The symptoms clear. The person feels fine, and almost everyone assumes nothing serious happened. A TIA is not a false alarm. It is a serious warning that a full stroke is coming. Research consistently shows that the risk of a full stroke within 90 days of a TIA is between 10 and 20%, with the highest risk concentrated in the first 48 hours. One study found that TIA patients who did not receive prompt medical evaluation had a nearly 10% stroke rate within just 2 days. If you or someone near you experiences be-fast symptoms that then resolve, do not feel relieved and move on. Go immediately to an emergency room. Tell them specifically you believe you had a TIA, because the window between a TA and a full stroke is exactly where medical intervention is most effective and most life-saving. Now, here is a finding published just 2 months ago in May 2026 that most people over 60 have never heard. And that changes how we understand stroke risk for older Americans specifically. A major study published in the journal Neurology followed 11,381 adults aged 45 and older across the United States, tracking who went on to develop ischemic stroke over a follow-up period of several years. The research was supported by the Cardiovascular Research Institute at the University of Vermont. The headline finding was alarming. People with migraine with aura, a specific type of migraine preceded by visual disturbances, flashing lights, or sensory changes, had a 73% increased hazard of ischemic stroke, even after adjusting for all traditional cardiovascular risk factors, including blood pressure, diabetes, smoking, and obesity. And here is the finding that surprised even the researchers. Men under the age of 72 who had a history of migraine, regardless of whether they had aura, had more than a 3.5-fold increased stroke risk. The researchers specifically noted this was counterintuitive, as prior research had focused almost entirely on younger women. This is a new and significant finding for older men, one most doctors have not yet had time to incorporate into their practice. If you have a history of migraines, especially migraines with aura, this information belongs in your next conversation with your doctor. Because it is a risk factor your doctor needs to assess alongside your blood pressure, cholesterol, and overall cardiovascular health. If you are a woman over 60, the stroke statistics are specifically alarming for you. 1 in 5 women will have a stroke during their lifetime. Stroke is the third highest cause of death in women, and women are more likely than men to experience the less well-known stroke symptoms, severe sudden headaches, nausea, fainting, and general confusion that are less frequently recognized as stroke warning signs even by the people experiencing them. This matters because the treatment window is the same for women as for men, 4.5 hours from first symptoms. But women are statistically more likely to dismiss their symptoms as something less serious, to delay calling 911, and to arrive at the emergency room outside the treatment window as a result. If you are a woman and you experience a sudden severe headache, unlike any you have had before, especially alongside any of the Be Fast symptoms, do not wait. Call 911 and let the doctors determine whether or not you've had a stroke. In summary, do the following 4 things to help you quickly recognize if you're having a stroke. 1. Memorize BE fast. B for balance, E for eyes, F for face, A for arms, S for speech, T for time. 2. Share this video immediately with your family and loved ones. Everyone in your household over 60 and everyone who lives near or cares for someone over 60 needs to know Be Fast. Because if a stroke happens, you will need to quickly recognize it, and Be Fast can help save lives. 3. If you have migraines with aura, put this in your next doctor's appointment. Ask specifically if your migraine history is increasing your risk of stroke and what you should be monitoring for. 4. Watch part 2 of this series coming next week, because knowing the warning signs is only half of the equation. Part 2 covers the 7 specific, science-backed steps that reduce your stroke risk, some of which can begin working within weeks. Check the description for the products I personally recommend to support your cardiovascular and brain health. And please like, subscribe, and share this video with your loved ones. Part 2 is next week, and it covers the 7 steps to reduce your stroke risk.